Then let's come to mental, neurological, and substance abuse. Handaktasu akwai CHO mayam ama mental health ki da training chatlubani yam thina kanaramgani na khalli aduna huziki aina hairakadoi miyam sisu adum almost loinamak moina cover tawbudi oiramani, but let's say akoina NQAS ki just point of view da adumaina sembane na khallasi. So NQAS ki point of view da sub center amagi level da kari kari no tawdoise. Ahambada screening or identification of common mental disorders. Next, the counseling services. Next, the referral services. Identification, early detection of mental health conditions through many screening tools, assessment tools mayam sizinaraga identification tauba. Counseling se hida chadringaida counseling hana tauba. Support group khara introduce tauba. Adagi counseling se ꯑꯩꯈꯣꯏꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯂꯦꯚꯦꯜꯗ ꯅꯠꯇ꯭ꯔꯒꯅ ꯇꯦꯂꯤꯃꯥꯅꯁꯀꯤ ꯈꯨꯠꯊꯥꯡꯗ ꯃꯣꯏꯁꯦ ꯀꯥꯎꯟꯁꯤꯂꯤꯡ ꯄꯤꯕꯤꯕ. ꯗꯦꯟ ꯔꯦꯐꯔꯦꯜ ꯁꯔꯚꯤꯁꯦꯁ ꯏꯐ ꯍꯤꯗꯥꯛ ꯆꯥꯕ ꯗꯔꯀꯥꯔ ꯂꯩꯔꯅꯤ ꯍꯥꯏ ꯇꯥꯔꯒꯗꯤ ꯇꯦꯂꯤꯃꯥꯅꯁꯇꯒꯤ ꯑꯣꯏꯔꯣ ꯑꯃꯗꯒꯤ ꯑꯣꯏꯔꯣ ꯍꯤꯗꯥꯛ ꯆꯥꯕ ꯗꯔꯀꯥꯔ ꯂꯩꯅꯤ ꯍꯥꯏꯔꯒꯗꯤ ꯔꯦꯐꯔ ꯇꯧꯕꯤꯕ. ꯁꯣ ꯀꯣꯃꯟꯂꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯕ ꯁꯦꯟꯇꯔ ꯑꯃꯗ ꯅꯣꯏꯒꯤ ꯁꯔꯚꯤꯁ ꯄ꯭ꯔꯣꯚꯤꯖꯟꯗ ꯄꯤꯔꯤꯁꯦ ꯑꯦꯡꯖꯥꯏꯇꯤ, hysteria, depression, neurosis, dementia, mental retardation, and autism never. But sigi autism, mental retardation sugumba mayam sidi akoina just screening and refer oidoini ko akoigi level da thoidokna tawningai leite aduna clinical services ki part ta pakna yaudi. So yengse akoina ahambagi awareness raise kai kai high awareness generation about mental health condition, stigma and discrimination, patient ki support system, appropriate referral si se area onangi service provision gi second part tani ko ai sida details se changaroige just horen sigi ango bana hairiba singje sigi sidang koina assessor lakpa matamda haibiyo ko. Then akoina deal tawdoriba mental and neurological substance use ki condition mayam se ahambada common mental disorders mayam ama, severe mental disorders mayam ama, child and adolescent mental health disorders ama, aduga atopa epilepsy gumba, dementia gumba, then substance abuse gumba adugumba. Common mental disorders ta akhoi da huzik concern oirise anxiety, depression, psychosomatic disorders ahum siniko. Anxiety is a queen at anxiety ki part mawong maniko panic disorder or panic attack haizina. So it's the same dum highway ai magi manaba mawong panic attack or panic disorder. It's an anxiety attack only. Depression, psychosomatic disorders sida hena focus tawdone akhoi common mental disorders sida screening gisu amagisu. Severe mental disorder akhoi khangdi khangjan gani but akhoi adugi do immediate referral oidoini ko. Severe mental disorder dadi schizophrenia lani. Schizophrenia di kamain tawi schizophrenia dadi yamna serious mental disorder ama oire hallucinations, auditory hallucination or visual hallucination or maze magi massage pura atopa amana maze keno tawgre na khanbe atopa ma ongre na khanbe schizophrenia se yam severe oiba mental disorder ne aduna adudi refer tawgrani. Bipolar disorder magi moods up and down chatpa. Then severe depression, normal depression stage yam severe depression, suicidal tendencies ka yawra kragadi severe depression oigre. Child and adolescent ta oibe abase conduct disorder hai taragadi angang se koigi repeatedly magi behavior se koigi kainoma violate tauba, class ta thugai khokai ba tauba, koigi imung du su thugai khokai ba tauba, destruction of property, deceitfulness kumba oiba, rule ama thugai ra haraujaba adu kumba mayam se conduct disorder da la eko. Attention deficit hyperactivity disorder hai taragadi ma se attention se mi na mo de attention gi wana te ko ma jing hak tang sida phone am pa magane si kanom lo shan ringe de kanom mong taw angkam holam ma kanom mong chieng raga kanom mong thup le ba de adu kanom taw ringe da ngahak sanaraga sanab zu lo shan da gum ta adi attention jing hak tang phajana concentration je taro thaba ma taw ba se ngam dam. Sumai tawdana oppositional defiant disorder haiba musulai other conditions like epilepsy, dementia is the kaugan baduni ko sigi MMSC examination na malay tool ma horen discuss tawsi. Substance abuse disorders like tobacco, alcohol and drugs. So these are the conditions we are concerned about in NQAS. So let's see common mental disorders. Sigi slide se direct ꯑꯩꯈꯣꯏꯒꯤ NHSRC ꯅ CHO ꯒꯤ ꯄꯤꯕ slide ꯇꯨꯗꯒꯤ ꯂꯧꯊꯣꯛꯄꯅꯤꯀꯣ depression or tension or stress when sadness lasts for a prolonged period starts interfering in our daily activities and relationship 하이ꯕꯅꯦ depression ꯁꯦ ꯑꯩ ꯉꯥꯏꯍꯥꯛ ꯊꯋꯥꯏ ꯅꯨꯡꯉꯥꯏꯇ꯭ꯔꯦꯅ ꯑꯩ ꯉꯁꯤꯗꯤ ꯊꯋꯥꯏ ꯅꯨꯡꯉꯥꯏꯇꯦꯅ ꯇꯧꯕꯗꯣ ꯑꯗꯨꯒꯤ ꯄꯣꯠꯇꯣ depression ꯀꯧꯗꯦꯕꯀꯣ depression ꯁꯦ ꯑꯩꯈꯣꯏꯅ matam ama lay timeline ama lay then when sadness lasts for prolonged period kuina prolonged period ta depressed sadness oiraba akoigi day to day activities ta kaira aba relationship ta kaira aba akoigi social life ta kaira aba then it can be termed as depression anxiety hai taragadi fear lasts for a prolonged period occur in episodes aduga anxiety di dum mayam khange dana ko akoigi fear oiba tohom khangdaba palpitations lairakpa pakhatpa thukatpa adugumba mayam do anxiety somatic symptom disorders hai taragadi akoigi physically kem nadaba ko mi je kem ma je naba anaba laita mai LFT KFT lipid profile whatever magi examination mayam je loi normal oiba but ma je masana ma nare na khajaba sigi se ma je nade na haibidi yadaba but magi jaga amada I do hakachar laire na khanbani khangde medical cause sunglai laitana magi symptoms je physical symptoms je utpa horakpa or possession disorders or the some magi mi je temporary loss of personal identity ma masa se khoigi mane na khanjaraktaba haitar atopana lawgre na khanba haitar so depressive disorder kamaina symptoms akoina kamaina identify tawni handaki do lo yawramani ko yam kana deeply changaroige sad mood loss of interest hana akoina lairamba habit ama hujik laigidraba hana kaigumba akoise music taba yam pamamba je pamgidraba akoina hana laijaramba hobby je adugi interest se mangraba energy yaudaba solitary confinement isa ithanda lainingbagumba adugumba oiraba those are signs of depressive disorder adugi mathak sida additional symptoms yauba yai like sleep disturbances headache body ache reduced appetite unable to concentrate suicidal thoughts hopelessness sugumba mayam se additional symptoms oina haibe so many other noida depression gi symptoms kara hairo haitaragadi mamangi lairiba ahum jana haibiro adui matungda makha taba amani lokhala hairsi yare loina ma haibegidi need oideko anxiety disorder fear of anxiety severe anxiety worry or fear kainoma tawkhibagi akoida pakhatlaga thukatlaga laiba panic attack haitaragadi adugi poto yamna kanna 10 to 20 minutes se attack tawbodo adugi poto ne panic attack haisina physical symptoms se anxiety disorder tokanda headache sleep disturbance kai laibe ai aduga restless feel tawni trembling khut kanikpa inability to relax me loin khang lai ko anxiety disorder haijin me sung ma me am di theory gi wane do whatever anxiety gi matang da lai sing do adum assessor da high be they will ask about common mental disorders depression anxiety somatoform disorders and sikisena sisisu akoigi CHO gi kano da gini ko mental akoigi kano state akoi kano myam je huji lai ba status myam je kai oiba yage aduduna kari thokan ba yage haibadoni ko anxiety laiba matamda panic attack thokpa yai sweating thokpa yai constant worrying ohan ba yai concentration da phalanda ba yai rapid heartbeat thon ba yai sor hon ba wa bo han ba yai puk na bo han ba yai overthinking to han ba yai sugum myam then somatic symptom disorders se aina ngasa haiba dumaina what are somatic symptoms somatic disorder mi se physical mangonda anaba amata leitana my headache lairakpa pain in the arms body pain back pain abdominal pain during the intercourse painful menstrual cycle sugumba mayam je psychosomatic pain with you mangonda phajana check tawruba matamdadi amata phangdaba haitar so that is called psychosomatic disorder next handak training su tala angani but we have to be very careful about mental health ki assessment tools mayams khwai ha hamada village level da asha MPW moi mayam na pai ga doba community informant decision tool na malai community informant decision tool je huzik phawda aina khanbada DMH3 dagi piraktribadi male mental health dagi pirakkhidabadi male mamangda aina moida suggest tawe sigi su supply tawbiona community informant decision tools na akoigi kenoda village level da ASHA natraga multipurpose worker na screening taunabani ko. Second dana standard screening tools which is used by CHOs. CHO na use tauriba screening tool khara lai. Number 1 da self reporting questionnaire or SRQ20 common mental disorder screen taunanaba. Then patient health questionnaire PHQ9 which is for depression, suicide tendency, risk adugumba yenganaba. Ahum subada audit which is alcohol use disorder identification tests. Sigi mayam se khara makhai di horen tharo hairak taragadi tharak naba khara makhai di screening taraga thambiyo. This can be done sigi se yum mamada changaga mi amakhaktang dai tawrasu yai yum mamada changaga mi manga taruk to question hangaga tawrasu yai ko. Case tracking MNS की register में थमगनी NCD register की type ता case tracking तौनबा अखोइदा MNS की mental की दी register में थमगनी. So let's see what is CIDT, let's see what are MMSC, what is SRQ20, what is PHQ9 audit si myam se kai nu yeng se bako. First thing CIDT community informant decision tool sigi se ngasai gi kenosina asha sina puraga chattoini ko. Sida magi kanose mana huziki hairiba mise sigi huziki hairiba mi sida yauriba signs se yaubra na tik tawraga dang puraktoine just tik tawraga puraktoine adu tik taw matamda yengaga mase sida mathakta hairiba mayam sida akoigi my symptoms siga chanaba yaubra hairagadi yaudregadi loire ko no match adi oidre kaigumba yaw taragadi adugi poto makhata na CHO da submit tawdoine ba si thamdoine ba du sigisina community informant decision tool sigi nakanda laisina moigi format tuniko. Then MMSC for dementia na ba mi ama kamaina screening tawge hai taragadi akoina moida question kara hangne kai question hangdoino hai kanda hauzik chahi karambano hauzik ching ningdam dara kalenla ngasi date kya no ngasi se kari Wednesday ra Thursday ra kai thano sugum mayams time je hangne. Then place hujik akoina laise kari state tano kai country tano kai town tano kadai tano kai laikai tano place se mo hanganeba. Then subsequently mayamama akoina object mayamama say for example phone, keyboard, mouse, pen si mari si amta haira o kaina smaina haihan bako adagi nang masing amta thiro o chama dai ka dingam draga so ahal lor kanda kun dagi maptha khar thiro o kun trampan trampan tratret smaina thirak pama. Then akoina pochai khara haira kanda adugi poto question khara hanga wari khara sajalaga aina ngasa haigiba pochai mayam do adugi maming sing do ontaga hairo kana. For example sida yauriba question mayams sida out of 30 sigida akoina magi kenose assessment se tawdoine MMSC haise sisina dementia gi screening tawbaine. Then SRQ20 akoina common mental disorder ama screen tawba matamda SRQ20 se yam live tool amani sida question kun laini question kun se magi akoina yes oiragadi 1 no oiragadi 0 karigumba sida last total sida 1010110000 tawraga last kaigumba 8 ki makhada oitaragadi SRQ20 if less than 8 no interventions required 8 to 10 oitaragadi counseling gumba psychoeducation gumba wari ama sanaba darkar oire if 11 ki mathakta laigraba adoigadi common mental disorder ama akoina suspect tawba yai and we will refer it to medical officer trained in mental health. SRQ20 self-reporting questionnaires 20 for screening of common mental disorders. Then PHQ9 hai taragadi question se mapan khaktang di hangba but magi answer se sigi 0 1 2 3 sida oiba kaigumba little interest or pleasure in doing things thabak ama tawbada thawai yauna harauna tawba ngamdaba tawbibra aduiduda adum thawai yawida hargadi 0 pirani handaki hafta sidi kitang di dumai lay hargadi si 1 pirani ai adumai dum taw lay re hai taragadi 3 pirani aduga handak tha ji sumai sum tawe hai taragadi 2 pirani adumai tawdana sigi mayam se mapan question mapan oija taragasu magi response se 0 1 2 3 oibana 27 oira ani ko 27 ꯑꯣꯏꯔꯛꯑꯕꯅꯤꯅ ꯁꯤꯒꯤ ꯁ꯭ꯀꯣꯔꯁꯤꯗꯩꯁꯤꯗ ꯇꯣꯇꯜꯁꯦ ꯉꯁꯥꯏꯒꯤ out of 27ꯗꯨꯗ ꯀꯌꯥ ꯐꯪꯉꯤꯅꯣ ꯍꯥꯏꯕꯗꯨꯃ ꯏꯕꯤꯔꯅꯤ ꯑꯗꯨꯒꯤ ꯁ꯭ꯀꯣꯔꯗꯣ 0 to 4 ꯑꯣꯏꯔꯒꯗꯤ normal range of full remission 5 to 9 minimal depressive symptoms 10 to 14 major depression 15 to 19 major depression moderate severity 20 or higher major depression severe severity ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤꯅ ꯗꯤꯄ꯭ꯔꯦꯁꯟ ꯑꯣꯜꯔꯦꯗꯤ ꯂꯩꯕ ꯃꯤꯒꯨꯝꯕ ꯑꯗꯨꯒꯨꯝꯕꯗꯅ ꯍꯦꯟꯅ ꯀꯦꯟꯗꯤꯗꯦꯠ ꯑꯣꯏꯒꯜꯂꯤꯀꯣ PHQ-9 for screening of depression and suicidal tendency- ga ꯂꯩꯕ ꯑꯗꯨꯒꯨꯝꯕꯗ ꯑꯩꯈꯣꯏꯅ screen ꯇꯧꯕ ꯌꯥꯏꯀꯣ then ꯑꯗꯨꯒꯤ ꯃꯇꯨꯡꯗ ꯑꯃꯨꯛ audit ꯑꯅ ꯂꯥꯛꯑꯦ audit ꯍꯥꯏꯇꯥꯔꯒꯗꯤ alcohol use sorry ꯁꯤ dependence disorder ꯍꯥꯏꯗꯧꯅꯤꯀꯣ alcohol use disorder identification test alcohol use disorder identification test se ꯂꯧꯗ꯭ꯔꯤꯉꯩꯗ ꯁꯤꯒꯤ screening ꯇꯧꯗ꯭ꯔꯤꯉꯩꯗ ꯌꯥꯝ ꯁꯦꯡꯅ ꯍꯥꯏꯔꯕꯗ ꯌꯨ ꯍꯥꯏꯕ ꯄꯣꯠꯁꯦ ꯀꯌꯥꯝꯗ ꯀꯌꯥꯝ ꯌꯥꯎꯒꯦ ꯍꯥꯏꯕ ꯈꯪꯕ ꯑꯃ ꯌꯥꯝ ꯗꯔꯀꯥꯔ ꯑꯣꯏꯕ ꯅꯠꯇ꯭ꯔꯗꯤ ꯁꯤ ꯃꯦꯟꯕ ꯌꯥꯔꯣꯏꯕ CHO ꯁꯤꯡꯅ ꯌꯨꯁꯦ ꯕꯤꯌꯔ vodka rum whiskey wine ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯇꯤꯡꯕ ꯑꯉꯧꯕ ꯁꯨꯒꯨꯝꯕ ꯃꯌꯥꯝꯁꯦ ꯍꯥꯟꯅ ꯂꯣꯏ ꯈꯪꯕ ꯑꯃ ꯆꯪꯉꯦꯕ ꯑꯗꯨꯗ ꯀꯌꯥꯝ ꯌꯥꯎꯔꯤꯅꯣ ꯍꯥꯏꯕꯁꯦ ꯁꯣ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯤꯌꯔꯒꯤ ꯕꯣꯇꯜ ꯑꯃꯗ ꯑꯜꯀꯣꯍꯣꯜꯒꯤ ꯀꯟꯇꯦꯟ 5% ꯌꯥꯎꯕꯁꯦ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤꯗ ꯃꯥꯒꯤ ꯋꯥꯟ ꯁ꯭ꯇꯦꯟꯗꯔꯠ ꯗ꯭ꯔꯤꯡꯛ ꯑꯃꯁꯦ ꯑꯗꯨ ꯑꯣꯏꯗꯣꯏꯅꯦꯕ ꯁꯤꯗꯩꯁꯤꯗ ꯍꯪꯉꯛꯀꯅꯦꯕ ꯃꯥꯅ ꯁ꯭ꯇꯦꯟꯗꯔꯠ ꯗ꯭ꯔꯤꯡꯛ ꯀꯌꯥ ꯊꯛꯀꯦꯅ ꯃꯥꯅ ꯍꯥꯏꯔꯛꯄꯗꯨꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯑꯩ ꯕꯣꯇꯜ ꯑꯃ ꯊꯛꯏ ꯀ꯭ꯋꯥꯇꯔ ꯑꯃ ꯊꯛꯏ ꯐꯨꯜ ꯑꯃ ꯊꯛꯏ ꯑꯗꯨ ꯍꯥꯏꯔꯛꯄꯒꯤ ꯃꯥꯒꯤ ꯑꯟꯁꯔꯗꯨꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯁꯤꯗꯩꯁꯤꯗ ꯗ꯭ꯔꯤꯡꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯇꯦꯟꯗꯔꯠ ꯗ꯭ꯔꯤꯡꯛꯁꯦ ꯀꯌꯥ ꯊꯛꯀꯦꯅ ꯑꯩꯈꯣꯏꯅ ꯁꯤꯗ ꯃꯦꯟꯗꯣꯏꯅꯦꯕ ꯁꯣ ꯑꯗꯨꯅ ꯑꯩꯅ ꯗꯤꯇꯦꯜꯁꯇꯨ ꯁꯤꯗ ꯄꯤꯕꯅꯤꯀꯣ ꯀꯩꯒꯨꯝꯕ ꯕꯤꯌꯔ ꯑꯣꯏꯔꯕ 5% alcohol ꯌꯥꯎꯕ ꯍꯥꯔꯗ ꯂꯤꯀꯔ ꯂꯥꯏꯛ vodka rum ꯑꯗꯨꯒꯨꯝꯕ ꯑꯣꯏꯔꯒꯗꯤ 40% ꯑꯣꯏꯔꯒꯗꯤ 30 ml ꯁꯤꯅ ꯃꯥꯒꯤ ꯁ꯭ꯇꯦꯟꯗꯔꯠ ꯗ꯭ꯔꯤꯡꯛ ꯑꯃ ꯑꯣꯏꯗꯣꯏꯅꯤ ꯋꯥꯏꯟ ꯑꯣꯏꯔꯒꯅ 150 ml ꯁꯤꯅ ꯃꯥꯒꯤ ꯁ꯭ꯇꯦꯟꯗꯔꯠ ꯗ꯭ꯔꯤꯡꯛ ꯑꯃ ꯑꯣꯏꯗꯣꯏꯅꯦꯕ ꯁꯤꯒꯤꯁꯤꯅ alcohol use disorder identification test ꯌꯥꯝ ꯇꯣꯏꯅ ꯇꯧꯕ ꯉꯝꯗꯕ ꯌꯥꯏ ꯕꯠ ꯑꯥꯏꯗꯤꯌꯥ ꯂꯩꯕꯤꯌꯨ ꯑꯗꯨꯒ ꯑꯃꯅꯤꯗ ꯑꯣꯏꯔꯒꯁꯨ ꯔꯦꯀꯣꯔꯠ ꯊꯝꯕꯤꯌꯨꯕ ꯁ꯭ꯀ꯭ꯔꯤꯅꯤꯡ ꯇꯧꯈꯤꯕꯒꯤ ꯁꯤ ꯌꯥꯝ ꯇꯣꯏꯅ ꯁ꯭ꯀ꯭ꯔꯤꯅꯤꯡ ꯇꯧꯕꯗ ꯌꯨ ꯊꯛꯄ ꯃꯤ ꯁꯧꯔꯛꯄ ꯌꯥꯝ ꯌꯥꯎꯕꯅꯤꯗ ꯇꯧꯕꯗꯤ ꯌꯥꯝ ꯀꯟꯅ ꯌꯥꯗꯕꯅꯤ but ꯑꯗꯨꯝ ꯈꯔ ꯔꯦꯀꯣꯔꯠ ꯊꯝꯕꯤꯔꯣ then psychosocial intervention techniques the number 1 psychosocial intervention technique number 1 se education and counseling oidoini suicide risk management kumba problem solving and behavior activation counseling sigise ai thamjaramage adum kona yengbiro ko next kisi yengseba medication management and follow up akhoida important oise medication pibasiga the doctor na prescribe tawraba medication pibasiga magi treatment adherence support follow up siga asigi ani sini yam important oise dispensing the drugs and follow up next emergency management of epilepsies epilepsy se magi kenoma I yam kana detail the changaroike but this is not included in NQAS but included in your work instructions hangakpa yai hangaktab yai adum kenodi toksanbiyo adubu important oiba ama haitaragadhi epilepsy se hek hawrappa matamda pung hana yengo masigi misina epilepsy seizure hawgibasigi time je hana yengo ba sub center dadi then maze fazana position amada thambiro safe oiba position amada thambiro left lateral position amada adum nikchasano yam kana faru no bako nikchasano left lateral position da thammakanda ngahak yengo aduga kaigumba haladagi hauna epilepsy diagnose tawraba mi oitaragadi midazolam spray noida laitaragadi laibadi leramoy but prepared oi hainanaba hangagadi haibiyo bako note the time ma position properly then administer the rescue therapy which is midazolam nasal spray one spray in the nostril patient ga nghaktang laibiro pungje sum yengo minute manga bau seizure sum taw lairaba then thuna refer tokthokpigo ado most of the times seizure epilepsy se kuiroi nghaktang just near kanda dum phagineba aduga maze fazana mafam amada pusanbiraga bed ta kay tawga hidak lang thak pibira kanda dumaina dum refer tawbi ko ba otherwise 5 minutes se leptana continuously ma seizure taw taragadi adui poto by any means keno tawbiyo na refer tawbiyo aduga ya se dum yengbiyo my oral cavity se yengbiyo ba magi keno gumba food particle gumba kai gumba yawbra khopra hamas mental health ki support activities ta kai kai haini awareness ta haini supports rehabilitation healthy well being si hanga akhoi kai gumba mental health ki matang da awareness or promotional da kai tawe hakta gadi si haibiro. Then social risk factors mental health sidana aina amtang ka haijauge mental health ki promotion da noina haidoi se promotion and support of mental activities that we do too ani step ani niko amana positive mayam se hairamba amana negative mayam se tawdana ba hairamba positive sing se tawnana ba hairamba which are all this tawnana ba hairamba aduga negative mayam se tawdana ba hairamba like gender based violence ki matangda yamna mana oiriba akhoi impact se mental health se da gender based violence abuse prevention suicide prevention substance dependence sigi mayam se tawdana ba hairamba ko aduna ani ni amana positive impact like gadauba like promotion of mental health. Number 2 the addressing the social risk factors which are gender based violence suicide prevention abuse prevention substance dependence sigi mari sidi phabiyo ko checklist yam clear oina ama yaubane GBV ne abuse prevention ne suicide prevention ne substance dependence ne. So work instructions ngasai kenoda mental gida high griba mayam duna most of them moise noi NQAS ki checklist gi high griba ngaktani adugi dagi hena mapanda thoidokna hango oe but kaigumba adugi details khara pam taragadi noi gi work instructions su loine yaubani aduga these are some of the common presentations and activities that needs to be undertaken under subcenter sigi mayam se adum ai slide su hapake from time to time khara adum yengbiro schizophrenia kamaina manage tauba bipolar disorder la agadi kamai manage tauba sigi mayam se yam detail oina work instructions ta yawe but NQAS ki oina di adu yaunadi hangaktabu su yai because atopa mayam am su yaubanina time leragadi khara adum yengbiyo ko. So these are like conduct disorder ai ngasa haba conduct disorder, attention deficit hyperactivity disorder, then dementia, alcohol, sugumba mayam siniko. So thank you. Ngasigi oinadi swaida sum loisalase ai elderly palliative emergencies adugumba mayam do hapke di toramane but it will be very long mayam tahaga keno tawdo mali loksan bado uisalla agadi ware idanako. So thank you. Any questions later di haibiro ko?